For the standard 4187, this is a standard that is used for all healthcare organizations for reprocessing reusable medical equipment and devices. This standard is used to make sure that the chance of infectious bacteria getting transmitted is reduced. This standard applies for all staffs that work around the reusable medical equipment to make sure that they know what the process of reprocessing those equipment are and the importance of the standard. The compliance requirements for this relevant standard, that this is currently the best standard in reprocessing reusable medical equipment. This standard sets the minimum best practice standard for reprocessing, and it is very important to follow this standard as it is determined to be the best practice standard that the Health and Disabilities Act requires everyone should follow. And this standard is used in all of the healthcare organizations that uses and reprocesses reusable equipment such as hospital, dentist office, and it excluded the single-use medical equipment or any item that is not meant to be used as medical devices. And for the standard 4815, this standard applies to those facilities outside of the hospital that can only provide the minimum required procedures for reprocessing instruments such as dental offices, acupuncture facilities, and it also applied to facilities that produce and supply the sterile equipment. For the compliance requirement, this is the industry best practice standards, so to comply to this standard is required, even though it is not legal. Even though it is not forced by law. The standard helps the office-based healthcare facilities with minimal standards for reprocessing reusable medical equipment. And this standard only apply to facilities that do non-complex procedures such as dental offices, GP medical clinics, or body piercing facilities. This standard does not apply to facilities that do complex procedures, and these facilities must follow the standard 4187. Also, this standard does not apply to day surgical or day procedure centers. Moving on to standard 8134. So this is the New Zealand only standard that points out the treatment for the disabled, which is applicable for any healthcare and disability services. The standard applies to both public, such as hospital, and private facilities, like private clinic. For compliance requirement, this standard is must be followed by any organization that's subject to this act, as it is required in the law. All the sterilizing technicians working in New Zealand must follow this standard, as they will be audited regularly. And this standard has 6 sections, but only the restraint and seclusion section is not involved in reprocessing equipment. The rest are I'll cut those. And for the compliance requirement for Act 8134 Any organization subject to this act must follow this standard as it is in the law. All the sterilizing technicians working in New Zealand must follow this standard as they will be audited regularly. This standard has 6 sections, but only the restraint and seclusion section is not involved in reprocessing equipment. The rest are, as they give instructions on how to follow the standard correctly. When it comes to who should apply this standard, this standard applies to all organizations that are subjected to the Act, such as physiotherapy, chiropractor, dental offices, or surgical services that provide treatment for the disabled. Not all organizations are required to follow this standard, but it is recommended that these facilities should try to follow it as it is the best practice.